Hello, I am Dr. Mary Carlson. I am a practicing podiatrist for 17 years, and I currently practice in the section called Williston Park in Nassau, Long Island. Neighboring towns where my patients come to see me are Albertson, Roslyn, Roslyn Heights, East Williston, New Hyde Park, Floral Park, Mineola, Carle Place, and Westbury. One of the problems or concerns that patients come in to see me for is, Doc, sometimes I get this shooting pain in between my toes when I'm walking. It feels like an electric shock going up in between my toes. What could this be coming from? This problem is actually called a neuroma. A neuroma is a swelling of the nerves. What happens is the nerve becomes swollen when it passes through a small area or a cramped area in the foot. So you say, how do you get a cramped area in the foot? Because of some type of anomaly, the bones in the foot, called the metatarsals, become very close together. When the bones are very close together and the nerves pass into the toes, it squeezes the nerve. When there is pressure on the nerve, it gets swollen, and you get a swelling of the nerve called a neuroma. When a patient walks or bends their toes, the bones push on the swelling of the nerve and causes the electric shock that they feel. So you say to yourself, well, how do I help these patients and make this shock in my foot go away? Well, what we usually do is, number one, we try to spread the bones apart, thereby creating a little more space for the nerve to flow freely. What happens is we can do that by using pads in the shoes or orthotic devices with pads to help press up the metatarsal bones. Another way which we get rid of this inflammation is by simply taking some anti-inflammatories, whether they are over-the-counter medications or prescription medications. Another way to get rid of this inflammation or the swelling of the nerve is to actually give what we call a trigger point injection, which is an injection into the area of a steroid and lidocaine to help reduce the swelling. Sometimes it may take 2 or 3 injections to get relief. So, I hope this was helpful. Thank you.